The community can have a really big impact on coronavirus by stopping the spread, and there's several simple things that we can do to stop the vulnerable people within our populations contracting the disease. So social distancing, what that does is it reduces the transmission of the disease within the community. So if you've got coronavirus, it stops you spreading it to other people. If you're a younger person, you can spread it to the more vulnerable people in society, such as the elderly or those with chronic disease, such as immunological problems, heart problems, diabetes, cancer and obesity. So it's a really important factor in reducing the spread. And what this also does is it minimises the impact that it has on emergency departments and intensive care units, so that we have the capacity to deal with increased numbers of patients but aren't overwhelmed by a large number of patients when they come to the hospital. Hand hygiene is super important. So the coronavirus is basically a bunch of genetic material that's surrounded by a shell of protein and grease. What hand hygiene does with soap or with an alcohol-based solution is it dissolves that grease and kills the coronavirus. So we recommend that you should be washing your hands very thoroughly and very frequently. Each time you wash your hands, it should be for at least 20 seconds. There's some really good videos on YouTube that you can have a look at from the World Health Organization, which show you the correct method for washing your hands. And what this really does, it protects you from contracting the coronavirus, but also protects you from spreading it to other people. So cough etiquette is really important. We'd really recommend you don't cough into your hand, because if you have the coronavirus, then it puts it onto your hand and you can spread it to other people. So we recommend coughing into your elbow or coughing into a tissue, disposing of the tissue and then washing your hands afterwards. We'd recommend for the over 70s that they should be in complete social isolation. This sounds really harsh, but they're the most vulnerable from the coronavirus. So we'd really recommend that your elderly relatives have minimal physical contact with younger relatives. They should perhaps have one person doing the shopping, but then they should have no physical contact with any other people for the duration of the pandemic. We'd really recommend that you use media such as FaceTime, video conferencing to keep in touch with them, but limit the physical contact.